that may want to pass out things regarding House Bill 41. Becky, could you get from either the podiatrist or the medical association or whoever things they want to pass out? We'll get cranked up. I was hoping for a couple more committee members. I believe it's after 3 o'clock. I'll ask the secretary to call the roll, please.
Bryan.
Here.
Parker. Barnett. Blackwell. Blunt. DeBar. Fillingane. Frazier. Harkins. Hickman. Hill. Hobson. McMahon. Parks. Polk. Tate. Turner Ford. Wiggins. We have a quorum.
It appears we have a quorum, such as it is. The first item on the agenda is House Bill 41, dealing with podiatry. Senator Parker moves title sufficient to pass and moves adoption of the amendment, which is on your desk, which has my name on it. And so I think that gets us procedurally where we need to be. And I would just tell the committee how I got to this amendment and everything. I want it to be the case that those who perform any type of medical procedure have proper training. I've become convinced, listening to the presentation before the committee and looking at what other states do, that there are some podiatrists who are properly trained to perform procedures on ankles and the related structures based on what other states do and the text of the bill and their training. The board has a number of safeguards. First of all, a podiatrist must go to 4 years of college, 4 years of podiatry school, which look an awful lot like medical school, although there is obviously more focus on the lower part of the body than on the upper part of the body. They apparently don't do scalps. Then after that training, they're required to have a residency program with training about ankle surgery, which I will call it. Their residency is at places where there's a 3-year residency program where the training is done by those who are there to teach students. And after that, there is the requirement of a credential from the in rear foot surgery. Podiatrists in Mississippi are regulated by the State Board of Medical Licensure. There's been much said for and against the State Board of Medical Licensure. No one's ever suggested they're really soft on podiatrists. So a lot of the questions that are really too technical for us will be dealt with by the Board of Medical Licensure. This authorizes procedures to be done in a hospital where a podiatrist is allowed to perform surgery. And with all of those safeguards, it seems that Mississippi will still be the most carefully regulated state or the strictest state in the nation for these procedures. I've made that comment several times intentionally so that if people knew otherwise, they would come tell me, because I just haven't sat down personally and read the laws of all 50 states. The only thing I've been told is some references to, I think, Massachusetts and perhaps Texas with some technical language. So I'm assuming that overwhelmingly the procedures we're talking about here are allowed in all but a couple of states. So having said that, that's why I have placed the bill before you, and I have offered, or I'm sorry, Senator Parker has offered this strike all, which is an attempt to further narrow the things. So that being said, is there debate on the bill? Senator Hill.
Has anybody on the committee looked at any of the scholarly articles in any of the medical journals when they compare the cost and the complications of ankle surgery done by an orthopedic surgeon versus a podiatrist?
I've seen lots of studies that have been handled to me here and again. I think most members of the committee have seen the handouts we've had. I doubt anybody's done an independent study of the literature.
Well, the ones that I've looked at basically say that it costs more because of complications. I'm looking at articles from 1997 all the way through 2019. Higher podiatry costs after ankle surgery, orthopedic trauma, higher podiatry costs, complication rates, quite a number. Pretty much everywhere you look in the medical journals, you will see that they say it costs more for these surgeries to be done by podiatrists, and that the complication rates are higher. So that's just my concern.
Okay. Anyone else? Senator Hickman.
Mr. Chairman, I would like to offer an amendment at the appropriate time to the.
This is the appropriate time.
Thank you, Mr. Chairman. I think that, of course, as members of this committee, we know this has been a subject of much debate and conversation, and I just want to make sure we get this right. So this time I would like to offer a reverse repealer so that we can continue to work on this throughout the process and see if there's any other changes that may need to be made.
Just personally, I have no objection to a reverse repealer if that's the will of the committee. Is there debate on the amendment for a reverse repealer? Not. All in favor say aye. All opposed say no. The ayes appear to have it. Further debate? Seeing none, the vote occurs on Senator Parker's motion, title sufficient, do pass, strike all as amended. Are you ready to vote on that? All in favor say aye. Opposed, no. The chair is in doubt. All in favor of the motion, please raise your hand. Okay. All opposed? What's the vote? 7 noes. 7 noes, 6 yes. Okay, the noes have it, and that bill will fail. The next item is House Bill 313, the Board of Cosmetology and Barbering. This is a proposal to combine those two boards. It's my understanding this proposal is supported both by the Board of Cosmetology and the Board of Barbering. And so Senator Parker moves title sufficient do pass on House Bill 313. Is there debate on the bill? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 315 is one of several bills that is fairly complicated, that in the sense that it's complicated, that's the wrong word, is very expansive in that it's got a lot of code sections in it this bill in particular attempts to simply replace the term mentally retarded with the term intellectual disability. Because we've got so many code sections going on among other things, and we need to conform and be careful. My suggestion to the committee is that we have a strike all with a reverse repealer so that we can make sure that those sections all conform as we go through the process. Senator Parker moves title sufficient to pass. It moves adoption of the strike all. Are you ready to vote? All in favor say aye. Opposed, no. It appears the ayes have it. The ayes have it. Now where the motion is vote occurs on title sufficient to pass as amended. Are you ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 764 is the repealer on the State Board of Health. I would suggest a similar amendment for the same reason. Senator Parker moves title sufficient to pass and moves adoption of the amendment. I would just mention one thing to the committee, and I'm having trouble phrasing this, but I think one of the things that's really missing in our approach to healthcare is to instruct somebody somewhere to have a comprehensive approach to the health of the state as a whole. The State Department of Health is taking it upon itself to do that. I think it would be well to have specific language in this bill saying that's one of their duties. And so that's one of the things I would hope to include in the bill as it goes through. But is there further debate on the bill? If not, the vote occurs on the strike all. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it, and then the vote occurs on title sufficient to pass as amended. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. House Bill 848 is a certificate of need. It's the same principle. Senator Parker moves title sufficient to pass and moves adoption of the reverse repealer strike all. Debate. Are you ready to vote? All in favor say aye. All opposed, no. The amendment passes. And then the motion is title sufficient to pass as amended. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. House Bill 1478 is an attempt to deal with what are called alternative nicotine products. I'm trying to figure out the verbiage for rolling my eyes, and I'm having trouble doing that. But nevertheless, we passed a bill, Senate Bill 2441, which differs from the bill that the House passed in that it deals with, I think, some of these things you put in your mouth, which was not the intent of the bill. So if I understand Senator Parker correctly, he's moving that we do a strike all replacing 1478 with the text of 2441. Did I get that correct? I did. Exactly. So, yes, so do you understand the amendment? Are you ready to vote, debate? All in favor say aye. All opposed, no. The ayes appear to have it. And the motion is title sufficient to pass strike all. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it, and we'll report that to the committee. House Bill 1640 is a bill that the House has worked on, which is one in a number of bills which attempt to deal with mental health commitment proceedings and all of that. I think the House bill that has come to us is a bit overly ambitious, but at the same time, I think it has a great deal of merit. And so I had drafted a strike all, which merely goes to section 3 of the bill and includes some of the House language that's in section 3. I believe the language that's in section 3 that's in the strike all is generally speaking non-controversial language. And I would, if the committee thinks well of it, I'd like to adopt that amendment. The purpose of this is so that we can fine tune this bill when we get to committee. It has merit. I'm sure there's some features of it that we can report back in a conference report. So Senator Parker moves adoption of the amendment. Is there debate? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it, and we'll report that. Oh, I'm sorry, then we need a motion title sufficient to pass strike all. All in favor of that, say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1660 involves cigarettes and vape products. This is one of a couple of bills. This would require the Commissioner of Revenue to establish a separate directory to help regulate the sales thereof. I was contacted about this late in the day, and in deference to others, I've brought it for the committee and asked the committee to report it out with a reverse repealer. Senator Parker moves title sufficient to pass and offers a reverse repealer. Ready to vote on the amendment? All in favor say aye. All opposed? The ayes appear to have it. The ayes have it, and Senator Parker moves title sufficient to pass as amended. All in favor say aye. All opposed, no. The ayes appear to have it. It appears the ayes have it. The ayes have it. We'll report that. House Bill 1676 is a bill involving hemp, intoxicating hemp, and Senator Blackwell has been working on that. Senator Blackwell moves title sufficient to pass and moves that we have a strike all with a reverse repealer. I know that Senator Yancey in the House, and I'm sorry, Representative Yancey, although he's also Senator Yancey. So like being an Eagle Scout, or once saved, always saved. Anyway, Representative Yancey has been working on this. I've asked Senator Blackwell to work with him, and he has. There are other interested parties that Senator Blackwell has been working with. There are some convenience stores that are very concerned about this. I've asked Senator Blackwell to hear out all of these parties. He tells me he's been doing that, but he wants to hear more. And for that reason, he moves title sufficient, moves strike all with a reverse repealer. Is there debate? Senator McMahon.
Mr. Chairman, thank you. Just want to be on the record that on this particular bill, if there's going to be some major changes made to this, that, every retailer, that the retailers that purchase products in good faith be allowed the opportunity to deplete their inventories. So they're not stuck with any products if there's if the bill becomes law and if it's successful.
Senator Blackwell, did you hear that? Senator Parker.
And just a question for Senator Blackwell, is the code section that could change the medical cannabis law part of this code section, or is this separate? So would you, as this goes along, would you keep me informed on any changes or anything you might be considering on that as this bill moves along the process?
Yeah, well, Senator Parker, and I've made a commitment. This is a containment bill.
Right.
What we're trying to do. There will not be any trick expansion of medical cannabis.
Very good. Thank you, Senator.
So the motion is title sufficient to pass as amended. Ready to vote on that? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I want to express my personal thanks to the members of this committee for your hard work. We have debated legislation. Sometimes we've debated it rather fervently, but that's okay. What we're doing is important. And each of you on the committee, as best I can tell, is making independent judgments about what we ought to be doing, and I thank you for that. It's a good committee. I'm glad you're all on the committee, and I wish someone would move we rise and report. Senator Parker moves rise and report.
Actually, I have
Park says a motion.
no, I do not. No, I would actually like to ask that that we had motion to reconsider House Bill number 848.
On House Bill 848. I'm afraid we have a motion to rise and report pending. And I think that takes precedence. I'll be happy to get with you.
I was trying to stop you, sir.
Okay. So anyway, the vote is to rise and report. All in favor say aye. All opposed, no. It appears the ayes have it. The ayes have it. Thank you. So you don't have to draft it.
Okay. That works.
Does this mean that a person is